Joining me now is Dr. Scott Powell. He's a ENT surgeon, ear, nose, and throat. Thank you very much for joining us today.
Thanks for having me.
So we're going to talk about the sinuses, and there's a lot of mystery for the average person on a sinus because there's a hole in our head, and we get a lot of pain from it. So let's start out with the simple stuff. Let's talk about some anatomy. What are the sinuses, what do they do, and where are they?
Well, they're located inside of our head, mostly towards our face. Two main purposes. Number one, they provide a hollow space in our head, so our head is not quite as heavy, otherwise it would be a large bowling ball. And number two, they provide humidification for the air that we breathe. And what you're seeing here essentially is the air wisps, hair wisps, bringing fluid out of the sinus so they can clear. This video now talks about the infection, and as the sinus gets blocked, they eventually will fill with fluid, which will then get infected, and then that's where the pain comes from in terms of chronic pain, pressure, and drainage.
And so this happens many times a year, and it's supposedly when we get the fluid up there, it's going to drain on its own, but there's some anatomy issues that we have problems with. I've heard people talk about deviated septums, but that's really not the whole story. There's more to this. There's little bitty sinus tracts up there, correct?
That's right. They're pinhole sized, and the problem there is when they do get obstructed from chronic infections and scarring and so forth, then it involves us having to go in and find a way out, whether that be the traditional sinus surgery or some of the newer techniques that we now have that are much less invasive.
All right, let's look at some of the video again because it shows us the sinuses themselves, the infection portion of it where it swells, and then the surgery itself. The surgery is not really nice, is it?
No, it has a bad rap. There's the famous roto-rooter people talk about, and this shows here one option where we actually remove bone and remove tissue. Obviously, you don't feel that during surgery, but the recovery can be pretty tough with the crusting and the difficulty post-operatively. So it's not ideal, but it does work, but it's not ideal.
I think the fun part is having the packing removed. Is that, I think you have a football yard up there, just stuffed up there as much as you can?
Well, luckily we don't do that much anymore, but it is still pretty painful in terms of how it coming out and uncomfortable. So people now, rightfully so, are trying to find minimally invasive ways to be less painful and less invasive, like I said.
So today we're talking about something that would hopefully fulfill all those. So this is a machine that goes up your nose and does something. Tell me about the specifics of it. This is the actual scope itself.
Yeah, so this is one of the devices, one of the companies, and essentially what we can do, we borrowed some of our tricks from our dentist colleagues. We get the nose very numb, about 20 minutes of numbing time, just all topical. And at that point allows us to pass this guide wire with the guidance of using a camera into their nose, this guide wire into their sinus, and there's a light bulb at the end that actually lights up to help guide us in the right direction. And then once that's in place, we can push the balloon over that. And then once that balloon's in place, we actually have an inflation device which blows this up rigid, which allows the tissue to be restructured away or opened, microfracture, some of the fancy words that we use. And essentially when that happens, you can see in this video, the bone gets moved out of the way, and that's what makes it permanent. It's not a stretching, but more of a permanent opening, again, borrowing the technology from heart catheterizations.
Wow. And this has been going on for how long? Is this a relatively new procedure, or this has been going out for a few years?
We've been in the operating room for about 10 years or so, but now we're able to do it in the office under local anesthetic, which has really changed the way people approach it because they don't have to go to the operating room and deal with that.
Wow.
So it's changed the way people will address sinus surgery.
So tell us, a typical patient coming in, it's not the first time they have sinus. They have to have recurrent sinus problems?
Yeah, usually it's upwards of 12 weeks of chronic symptoms, fatigue, crusting, lack of smell, facial pressure, headaches, not so much the cold type symptoms. And when that happens throughout the year, they've had enough is enough. They've been on antibiotics many months of years of their life, and they're sick of it and all the side effects. So they're looking for other options, but always scared of that sinus surgery issue. So this really changes what we can offer.
Absolutely. How long does the procedure take?
Whole thing, it takes about 40 minutes. They can drive, if you do it in the office, they can drive in, they can drive home. There's zero limitations.
And the recovery time?
Recovery time is almost immediate. They go back to normal behavior same day. I have some patients go back to work.
Wow, all right. And you said the outcome is about the same as surgery, better than surgery, or what's the difference?
So the studies are showing that the outcomes are equivalent going forward. It's been about 3 years on that study, which is in our world very, very good so far. And so there are exceptions to every rule, but in this case it's showing equivalent success to sinus surgery in the proper patient.
Gotcha. Now who would not be a candidate for this?
Some patients who have large polyps in their nose or other things obstructing the view, then they really do need someone to go in there and help give them a clean slate with removing some of the tissue you saw in the video.
Okay.
Those are a classic one we tend to steer away from the balloon option.
And if you have it done once, can you have it done again?
You can, but if you treat the other reasons why you got there, you shouldn't have to. It should be a permanent fix, just like sinus surgery, and that's the nice thing. But you could. It doesn't preclude you from doing it, But one thing we try to do is not just address the sinus issue, but also the nasal issue that got them there.
Okay.
And that's going to be.
And so there's obviously different types of sinuses. We have the frontals and the maxillaries. This is good for both of those?
Yeah, so this device, there's different heads to it. It can address the cheek sinuses, the forehead sinuses, and also this sinus in the back of our nose called the sphenoid sinus.
Wow.
So all those sinuses can be addressed under this technique, and in that sense, it works very well. Again, avoiding having to go to the operating room if possible, but if need be, we can do this in the operating room as well.
Excellent. Now, you do this out of your office. Where's your office?
We have 3 offices. Well, one's in Tampa off of Armenia, Brandon location, and then we're opening one in Riverview.
Wow.
So,
all right. So you're a busy man.
We do them in all the offices because we want to make it available because it changed the way we can help our patients.
Excellent. And you said follow up. Do they come to see you again, or is it pretty much a one and done, and you don't worry about it anymore?
We usually see them back in a couple weeks to make sure they're healing, because they do a lot of rinses afterwards to make sure they're doing better. And at that point, depending on what other issues they have, sometimes that's enough. Sometimes they do come back as part of the treatment modality, but for the most part, that one visit and they're doing well immediately upon leaving the office.
Wow, awesome. Sounds like a great idea. I know the horror stories about the surgeries in the past, the packing and everything else, so if this is an alternative that works just as well, sounds like something a lot of people would be interested in, especially in Florida.
Yeah, no, with our climates and our allergy symptoms, this has worked well for a lot of people, so we're trying to spread the word because people's fears have kept them away for a long time.
Yeah, fear is a terrible thing. Thank you so much for sharing this technology with us, and thanks for coming in today.
My pleasure. Thank you.